Welcome to Crossroads of Health, where common sense and good science intersect, with your hosts Rick Simpson and Melody Martorana. And now it's time for Crossroads of Health.
Good morning and welcome to another edition of Crossroads of Health, where common sense and good science intersect. Always real, always unscripted. I'm your host, Rick Simpson.
And I'm your co-host, Melody Martorana.
And we have another exciting show for you today.
Now, Rick, I know we've also got some really exciting talking points this week. Do you want to get us kicked off with those?
Yes, I'd love to. Well, actually, every week we do these talking points. It's just interesting information that Melody and I have read or come across, and sometimes it relates to our products for the week, and sometimes it doesn't. This week, my talking point does relate. And before I actually get into my talking point, I want to mention something that I did read on the internet, which many of you may have read, but it was the relationship between pollution in the air and arthritic symptomology. So there are so many things that affect our joints negatively, weight gain, pollution in the air, certainly, things like, trans fats and things like that cause inflammatory response in the body. But you really want to watch all these things. And this is why supplements are so important, because you want to be able to deal with those pollutants that we breathe, or at least try and live in a clean area. A lot of people in San Diego, if you live close to the ocean, that's nice because at least you get a nice ocean breeze and you don't get as many toxics. But that's one thing. This other study that I have for my talking point was something that Dr. Stengler had highlighted in one of his books. And what it said was the Canadian researchers, they examined the association between synthetic hormone replacement and a new diagnosis of arthritis. This is a big problem. It was discovered that women who used synthetic hormones for 5 years or longer were twice as likely as non-users to develop osteoarthritis. A separate study examining synthetic estrogen replacement therapy in arthritis found a 96% increased risk among women who used it for 4 to 10 years. Now, some people out there don't understand the difference between natural hormone replacement and synthetic hormone replacement. Synthetic hormones are not bioidentical. They're synthetic, and they're a completely different molecule than your body is accustomed to, and your body has to detoxify those synthetic hormones, and all of those synthetic drugs have liver toxicity as one of their side effects. But what I actually was not aware of until I read this study was that these synthetic hormones can cause arthritic symptomology. And so this is a big issue. So for women, especially as you age, if the doctor wants to put you on hormones, you should ask for natural progesterone or natural estrogen. There are pharmacies all around the country that provide these natural hormones. The reason that the drug companies don't want to supply these to you is because they cannot patent a natural molecule. So they have to give you a synthetic molecule. So that's really important. And also keep in mind, many of the meats out there have estrogenic compounds shot into them because estrogens cause the cows to retain water and store fat, which makes the meat weigh more, which makes you pay more when you're buying it. That's why it cooks down so far in the pan. But you really want to eat meats that are grain-fed, that don't have those hormones. Places like Sprouts, Whole Foods, they have those grain-fed meats. That's really something you want to look at. So anyway, just an interesting talking point.
And that also affects our dairy products too. So, you also want to look for hormone-free milks and cheeses and things like that. It's really ideal if you can eat organically and hormone-free, because all of those things can really throw the system out of whack.
Yes, they can. And so that's really my heart in this, and Melody's also, is to just eat as naturally as possible. Eat things the way that they come from nature, and nature didn't develop, or God actually didn't create synthetic hormones or drugs. So we want to definitely limit those things as much as possible.
And I know that we've mentioned this too in past shows when we were talking about the hormones and how they're affecting the next generation of Americans. I mean, we've got children that are developing at a really young age. There's 8-year-old girls who are starting their menstrual cycle. And, it's sort of the body signal that, your body's maturing to a different level. And at 8 years old, really, that's very difficult for a little girl to deal with. And
the hormone issue is such a major issue. That's one of the first things that Dr. Stenger looks at when he sees patients. We got to balance out all the hormones. I heard him say that when we were there. He goes, got to balance those hormones. That's really important. important, and so much of the food supply is creating imbalances because of money. Now, Melody, I know you have a really great talking point today dealing with joint pain also. So what do you have for us today?
This is actually a great little article that was written also in Dr. Mark Stinkler, naturopath medical doctor. He's down there in the Encinitas area, and he formulates a lot of the products we're going to be introducing today as well. But this was part of his House Calls newsletter, and it talks about how household chemicals cause osteoarthritis. And I just want to read you this article because it's a really good article. They're the secret ingredients that add a touch of modern convenience to everyday life, making products no stick, stain resistant, wrinkle free, waterproof, and more. They cost a little more at the register, but the real price of all that convenience isn't money. It's years of pain and suffering, because polyfluorinated compounds that make it all happen could eat your joints from the inside, with new research showing how some of these PFCs, that's what they're referring to now as polyfluorinated compounds, can increase the risk of osteoarthritis in women. Women with the highest levels of exposure to two PFCs, known as PFOA and PFOS, have nearly double the risk of osteoarthritis of women with the lowest levels of exposure. The risk is highest in women between the ages of 20 and 49, and a little lower in women over the age of 50. That's almost certainly because many older women didn't grow up with the PFCs that are absolutely everywhere now. If you're under 50, however, odds are these chemicals have been with you every moment of your life, from birth until right now. You'll find PFCs in your kitchen, bedroom, and bathroom. They're in your furniture, on your walls and floors, and in your clothes. They're even in your food, and all that exposure can add up to a lot more than a higher risk of osteoarthritis. In women, they increase the risk of early menopause by 40%. And early menopause itself is a risk factor for heart disease, stroke, osteoporosis, and more. In men, PFOA has been linked to testicular cancer. And in one new study, prenatal exposure to PFOA increased the risk of low sperm counts during adulthood. And in men and women alike, PFCs can cause immune system damage, hypothyroidism, birth defects, sexual dysfunction, and more. One study I told you about recently, this is Dr. Singler, of course, speaking, found that PFOA can increase the risk of kidney cancer by 170%. It's almost impossible to eliminate all sources of PFCs at this point, but you can dramatically reduce your exposure to some of the worst, such as PFOA and PFOS, by simply sticking to some of the old-fashioned options you grew up with. Since one of the most common sources of PFC exposure is from no-stick cookware, you can start by purchasing a good cast iron skillet, I know we have one in our house, and work with a doctor who can put you through a detoxification program to reduce the levels of PFCs and other toxins in your body, no matter where they came from.
Wow, that's a lot of information, but it's really good information. And the fact that Dr. Singer mentioned about going to a good doctor, I need to say that Dr. Singer, he's a fantastic naturopathic medical doctor, out of Encinitas. You can look him up on the internet. But we're out of time, so we will see you all next week. Thank you for tuning in, and please come back next week for another edition of Crossroads of Health.